everyone, and welcome to this live interview. Today we are joined with Dr Namrata Bhattacharya-Mis from the University of Chester to explore how populations living in locations that experience dual disasters, we'll talk about what a dual disaster is, can prepare and reduce hazard risk. Our discussion today will focus on the vulnerability of flooding in Bangladesh and its intersections with the impact of global pandemics, and hopefully we'll begin linking to like real places and kind of strategies that communities use and how we can reduce this risk. So I'm really looking forward to it. I'm going to pass over to Namrata. If you wouldn't mind kind of starting by telling us, what is your area of research?
Hi, Ellie. Thank you for the invitation to talk about my research today. I'm a geographer by training, and my research interest is positioned at the intersection of physical geography, human geography, and development studies, so kind of in the middle. Most of my research is multidisciplinary, and my particular interest lies in the understanding and managing of the consequence of water extremes, so flooding, especially in the context of societal vulnerabilities.
And today we're going to kind of talk about that, linking to this idea of kind of a multi-hazard or dual hazard area. So first of all, please can you tell us what is a hazard for our maybe younger students, but then importantly, what is a multi-hazard or a dual hazard?
So in recent years, we have been hearing a lot about compound hazards, multiple risks, and to better comprehend or understand the effect of multiple things happening together. So multiple disasters, either occurring simultaneously or one after the other, which are either independent or they're dynamically coupled. They are in close association with each other. So extreme climatic events such as droughts or cyclones, volcanic eruptions, landslides, and other natural hazards, or even public health crisis. We have seen things like pandemics, which has threatened human lives, societies, and which is compounded with other hazards or disasters such as a flooding or a cyclone happening together with that. So that's what multiple hazard is all about. Here, since we are talking about two hazards together, hence the name was given dual hazard for the purpose of this research. I can expand a little bit on that. So the outbreak of COVID-19, as we know, is an unprecedented event in the last century. And several social distancing measures were in place. We remember that globally, it was used to combat its infection rate. Now, the COVID-19 emergency has actually, for some time, overshadowed public reckoning of climate crisis. Now, only a few months after the start of COVID-19 pandemic, several climate hazards collided with the outbreak itself, which jeopardized the sensitive public health work, while countries like Bangladesh, which would be the focus of our talk today, were struggling to tackle rising infections. There were events such as the cyclone, which will be the main focus today, is the cyclone Amphan, which was one of the largest cyclones Bangladesh has seen in the month of May, around that time, which claimed the life and livelihood of thousands in the midst of COVID-19 pandemic. Now, the challenge was of managing this dual disaster, although it's not very new for many developing nations. We have seen things like that before. We have encountered in the disaster management studies before. For example, we have seen it during the outbreak of Zika virus or Ebola outbreaks. We have seen this before. Circumstances were slightly different in times of when we had the global pandemic of COVID-19. The, there were needs for significant different level of preparedness. There were challenges, and there were lots of trade-offs that were required, which were compounded with the vulnerabilities of people at risk. Now, if you are already vulnerable, economically poor, having lost livelihood, when you have another level of disaster on top of that, it becomes more, it becomes overwhelming. The pressure becomes overwhelming on an already overstretched economy or resources. So, what happened in May 20th, 2020? The southwestern part of Bangladesh was hit by cyclone. The name of the cyclone was Amphan. Although the eye of the cyclone was predominantly, traversed in India, in the state called West Bengal, it passed through the Bangladesh very close to the border with India. The area was particularly, the name of the area was Shatkhira. Now, once this happened, I have a very close connection with Bangladesh because I come from that area and my parents were living there. I was very worried what's going on there because for 5 days straight, there were no electricity, there was no mobile connection. So, hence my personal interest in this research. Now, most people in the cyclone affected area in this part of Bangladesh were living on daily subsistence wages. So they're mainly very already vulnerable. They were poor people. And Cyclone Amphan imposed additional stresses, taking away their livelihood, mainly, any capitals that they had, whether it's their asset, their livestock, their farms, and the daily income. On top of that, there was the pandemic that was already raging. So that's kind of took away the livelihood from people and made them even more vulnerable. Hence, this particular dual disaster was slightly different from the others we have seen in the history of disaster management.
And I think what's really interesting is sometimes students talk about multi-hazard zones and we think about places that might have earthquakes and floods or kind of two kind of natural hazards like formation. I think what we're kind of really talking today is about actually what does it look like when you have a pandemic as a hazard and then a natural hazard as well. So I think that's quite interesting in terms of those, like, particularly very relevant as in it's happened very recently in students' lives as well. But how do kind of communities cope with that? And it's so great that we've got so many people joining live. If you do have any questions, please do write them in the chat, and then we'll either kind of feed them through or answer them at the end. So you've kind of mentioned Bangladesh. So if we kind of talk about preparation, how can coastal populations prepare themselves in advance of a disaster? Especially how can populations cope with dual disasters of a cyclone, say, and a global pandemic?
Bangladesh it's an interesting case study because cyclone is not new for Bangladesh. Bangladesh is prone to cyclones, the frequency and severity of which is thought to be increasing due to changing climate. The country's vulnerability to these natural hazards actually has attracted support from several organizations, the World Bank, UNDP, and this has helped to improve disaster preparedness. And it's actually one of the very good case studies for disaster preparedness because Bangladesh has come a long way. What happens, the cyclone, why does it come so often to Bangladesh? You may have seen in one of the slides where you can see a lot of, a number of cyclones are passing through Bangladesh, especially during April and May. Often tropical depressions happen in Bay of Bengal, and it's and also in post-monsoon time between October and November. So cyclones pose challenges to the lives and livelihood of people. About 30% of Bangladeshi population who live around the coastal areas, and also they are very poor. They are considered to be very vulnerable to, they don't have better infrastructural facilities. They are in poor socioeconomic status. Hence, they are quite vulnerable to this kind of risk. Thankfully, understanding the risk and disruption posed by cyclone has received considerable attention over the years. And given that in the background of COVID-19 and this cyclone came, when we started doing our research, we were able to understand a bit more about how coastal population prepared themselves in advance. Now, it was not only about how the coastal population helped themselves or prepared themselves before the cyclone came. To understand how the population can prepare themselves or to cope with a dual disaster like this, it's also important to understand what does disaster preparedness entail. It's the basic theory is not only what can coastal population do. If we know the theory well, it can actually be used in other parts of the population also. It doesn't have to be coastal. Depending on wherever the cyclone is happening, this can be used in other areas as well. Now, there are a few things about preparedness. And one of the key stages of preparedness is one of the key stages of disaster management cycle. You may be already aware of that. It involves risk awareness, advance warning, risk communication, capacity building. These are the key things about any preparedness measure. Now, it has been acknowledged that if we prepare well, it can reduce the negative disaster experiences significantly. And there has been a change of approach also. And this approach has been moved from top down to bottom up. Now, what does that suggest? That suggests putting the community at the center of disaster risk management system. And this is what happened during the dual disaster. Any kind of disaster management that was to be effective, they had to ask the community what do they want first. And that is the only time they have seen, when they have actually consulted the local people, the effectiveness of the preparedness was much higher. Now, what happened in this case? As I mentioned before, Bangladesh is prone to cyclones. So the Ministry of Disaster Management and Relief, who is responsible for coordinating national disaster management efforts. So the coastal population has a reasonable understanding of cyclone risk, and they have their own ways of reducing those impacts. They know to secure their houses, they would, use ropes, they would bury their non-perishable assets, they will seek shelter in designated buildings, which are also called storm shelters. And also they knew how to safeguard their animals, which were their main livelihoods. However, the challenge was that the knowledge does not always translate into action. There were a number of indecision, there were a number of not realizing when to act, and also there was lack of shelters. Now, although in normal situation, this would be, they would know what to do, because of the additional COVID-19 pandemic and the rules that were there, it was problematic for them to even use their own knowledge in that situation, because the situation was different in this case. Now, the government, used a lot of money to improve preparedness and to provide infrastructure, transport network for about 14 million people in the coastal region in Bangladesh. It happened in 2014 when they started, more than 500 new shelters. They rehabilitated more than 450 old shelters. They built a number of new areas where they can keep their livestock, and people knew what to do about that. The problem was more about during Amphan that COVID-19 specific preparedness measures included use of additional shelters to reduce overcrowding. Now, we all knew how the area that was affected by the cyclone, they were quite densely populated. Now, the COVID-19 preparedness measures were more about social distancing. And the shelters that were there available were not enough to keep so many people in a socially distanced manner. Hence, what happened, despite the strong institutional setup, which had infrastructure, it was just not enough to support the number of people that needed evacuation. Not only that, it also had added issues about providing wash facilities, providing soap, sanitizers, isolation cases in case of health impact. So that made it, these were the resource mobilization hurdles that they had to face. There were lack of coordination, poor policy and operational linkages. So whatever people were thinking in the top, that did not come to the field so people would know what to do. So there were a number of miscommunication, which is again another important aspect of preparedness. Everyone whom we asked when we started doing our research, and we tried to get what are the core associations, which are the most important links, whoever we have asked, we did a number of interviews, they said that they have had warnings. So that was a very good thing. People knew what to do. They have known that there will be a big cyclone coming. They just didn't know exactly which path it will take. They used handheld sirens, megaphones, bicycle-mounted loudspeakers. They even knocked at doors. They used mobile phones to warn people. So the responses were quite good. The only problem there was that there was not enough manpower during that time, which challenged people. The responses were often criticized in that means because they came last minute due to under-resourcing. Hence, the vulnerable households, they failed to actually receive it on time to move out of their homes and go to a secure home or secure area. And even if when they managed to respond, there was limited areas where they could move to. So that became a really, to enhance their capacity to respond. This became a real big problem in times of this particular dual disaster.
It's quite interesting because obviously a lot of kind of COVID measures as well have also been critiqued quite a lot with maybe like hindsight and maybe knowing what was best. And yeah, it's quite interesting, like particularly when we're facing a new hazard such as a global pandemic. How do you manage to cope? But I suppose, as you were saying, that communication is really important. So the populations knew what to do, but it was maybe a mismatch in communication, or like kind of completing it so that vulnerable people were also protected.
Yes, and the issue was not only that they didn't know what to do. The issue was that there were two different types of, the communication was coming from two different sources, telling them to do two different things. On one side, they were asked to go to a shelter. On the other hand, they were asked not to be together, not to be in groups, not to, so the clarity of communication was lacking in this one. And I don't think we can blame directly the disaster management organization there, because they themselves didn't know what to do, and they were learning as the time was going. So that became a real big problem, and many people lost their livelihoods because of that. For example, people who were they in Bangladesh, embankments, especially in the coastal region, were highly valued for their protective capacity, and they are resilient measures which is offered to livelihoods. It is, however, very important that when coastal embankments are part of the road network, they are always connected, and people do a lot of shrimp farming there. However, when Amphan came, because they couldn't protect there, the whole area was uh, devastated by saline water, while the shrimp was able to grow only able to thrive only in the sweet water. So their entire livelihood was based on how they could protect that, but that wasn't possible. They didn't know what else to do. They couldn't move they didn't know the pathway of the cyclone. So that became another issue, and that took a long time for people to come back and prepare. This is something they couldn't prepare beforehand.
So obviously there are so many lots of different factors that kind of can impact a disaster, as you've mentioned. But what do you think is key to disaster preparedness?
I would say capacity to respond. What is your capacity? The adequacy of any disaster management, disaster risk reduction measure, um, whether we are talking about to enhance coastal population here, for their capacity to cope. It was significantly tested during Cyclone Amphan, especially due to the parallel threat of COVID-19. The pandemic increased the vulnerability of coastal population and reduced its capacity to cope with the hazard associated with natural causes. Now, that made them more vulnerable. Why? Because it was exacerbated by declining income. They say that about more than 60% reduction in income during that time has happened to those people who were also affected by cyclone. And on a level of unemployment rose by 55% during that time. So both of them had actually had a higher impact on the effectiveness of disaster preparedness and their capacity to respond. In especially whether it's single or multiple disaster, it depends mainly on how community carry out the measures required to reduce risk. And capacity of a community or an individual to respond to disaster often uh, reflect what is their degree of vulnerability, how vulnerable they are at that point of time. In this case, we have had a look at the building and type of building they used to live, shelters they would go, who is the dependent population, what was the level of employment, whether they are educated, what's the level of literacy, whether their economic capacity is poor or is it weak or strong. These are key contributory factors to human vulnerability, and this all help people to anticipate or to cope, or you can say it helps them to resist and recover from impact of any hazard. If there is a strong capacity to respond, people will recover faster. They will have better ability to cope. So for me, I think understanding the capacity to respond is one of the key aspects of disaster preparedness.
And then, what are the challenges that we've said about capacity to respond is really important, or the capacity to cope? What are the challenges that restrict capacity to cope? And maybe kind of flip on that, what is it that can create a strong capacity to cope as well?
For managing any kind of disaster and to prepare, I think that challenges that we often face uh, are problems with lack of coordination, um, lack of poor governance, inadequate support from different institutions who are responsible for helping people with disaster preparedness, and not having the plans that are inclusive for different parts of the society. So what do I mean by that is, if we talk about lack of coordinations, uh, 2 days prior to the cyclone, people were alerted to the risk and measures that they should take in order to reduce the impact. But health security during transit to the occupation of shelters were omitted. Uh, there were poor preparedness due to the lack of coordination between who are planning, who are taking them to the health shelters, safe shelters, who are planning for the healthcare provision, who are planning for the supply, because it's not only taking people and moving to another sector. It's about how well the area is planned, how well the shelters are prepared to take all those people. On top of that, wash facilities, wash systems were not made available. Hence, there was a lack of coordination between disaster management organization and the local health organization, local authorities. That was a lack of coordination. It's an example. Another thing was about insufficient institutional support. So everyone, whoever we asked, all participants said that they were given some money in order to, whatever livelihood or as a capital to, build back again their livelihood that they have lost. But the amount was so small that it actually did not help them. They used it within a few days because they had to get their own food, they had to get their own, basic needs. So that was not, and COVID-19 restrictions on top of that, because people were living under the poverty line anyways, more than 70% of the people live over there. Their daily wage, they didn't have the daily income that they normally used to have. And additionally, not everyone received the relief money, because the money was distributed based on uh, some people decided that they are the one who will decide who gets the money and who doesn't. So there was a problem of poor accountability and corruption. So, and it did not only come, so when we were interviewing, we didn't only ask the poor people, or we asked kind of a general, we distributed our sample so that everyone is equally, investigated for the purpose of the investigation. And we have received similar sort of views from both people who were directly affected and people who were responsible for or involved in community support groups in distributing reliefs and things like that. So there is this problem of, it's a prevalent problem of corruption in the system, and also there was a problem with long supply chain, fund distribution and things like that. Finally, the issue of inclusion. Um, I already mentioned about repairing embankments. That definitely was one of the priorities. However, it was not considered until the very end, because when they lost their livelihood, the first thing the people wanted was repairing those embankments, because that's their livelihood. However, government had a plan, and there was a slight disagreement between people and the local authorities, because they have a long-term plan of repairing embankment, and they were waiting for a big fund from an outside organization. However, local people wanted immediate change and immediate management of the embankments in order to help them. Now, as a result, although they thought that okay, they will do it eventually, but when they will do, by that time, there was no support to the people. And hence, the capital that was left, whatever leftover capital they had to invest, or they had to get money from people who were, from local people who were charging very high interest for that money. So overall, it did not help them. So the plan needed to be truly inclusive. It needed to understand, and it should have been based on the priorities of the vulnerable group in the first place.
I just wanted to draw on a few things, and if anybody does have any questions, please do write them down as well. Do you think obviously they knew the pandemic, there was a pandemic. Do you think there should have been a clear pandemic disaster plan kind of put in place before?
Yes, because this is not the first time we are seeing something like that. Although, maybe the scale was much bigger this time. But I think we have seen from our historical experience, we have seen that there was always a possibility of a pandemic. And I think every country should have had in their contingency plan that what if. And the pandemic didn't just happen in a day. We got some time to understand. Yes, we didn't understand it totally, but still, if there was a contingency plan, it could have been done in a much more organized manner. However, we have to also understand the challenges, because the fund is not enough, and not all the fund or resources could be used for disaster management, because that was going in another direction. So priorities needed to be set, and that everything needed to be done very quickly. So there has to be a balance between the two. And that was, I think, our reflection from this is that when we spoke to the experts and the policymakers, we learned about their narrative, their challenges. And when we talked to the local people, we understood their challenges, their narratives, their priorities, and not often those two priorities overlap, which is unfortunately a big challenge. I think countries which are economically weak or are developing, they have these challenges, and overcoming them should be a priority for the government.
And I think that kind of links, I think we had a slide, and I haven't actually managed to put it up yet, but the kind of two sides of the story, where it talks about disaster management official and community members. Would you mind talking through what this is showing to students?
Yes, so this one is when we were talking, in our research, we were talking to a number of people from different parts of the society. So, and because the storm we did this study for both India and Bangladesh throughout where the storm passed. So we asked many people. So often we saw that many people in both countries were not leaving their homes, even when they knew that the big cyclone is coming and it might be threatening their lives, because the worry was that they were more worried about getting infected for a disease they didn't know much about. They knew about cyclones. They had some knowledge about cyclone. They knew how to manage a cyclone, and they have seen it before. However, in shelters, they were aware that there is more possibility that they will get infected in those storm shelters. So even when, and they didn't know if there is enough food supply, if there is enough medical supply, how they will be socially distanced, whether they will be, because often in Bangladesh, in some certain shelters, male and female people are kept separately. So they were also worried their families will be separated, and they didn't know what's going to happen, because at this time it was the peak of the pandemic. So they were anyone who was infected, they were also socially secluded. So that became a real genuine issue for people. So they wanted to stay at their homes, stay with their families, so that they can be, to stay together. And this became a problem for the disaster management officials, because they wanted people to move to shelters, uh, but their problem was that they could house a number of people in one room previously. So, but during the pandemic, they were told to keep the social distance, but they didn't have extra shelters to put the people. So now it became a problem. On one side, they had to move people. On the other side, they didn't have the shelter to move people. So again, it's a vicious circle that they had to face, and decisions had to be made immediately. So that's what that, the dilemma of disaster management, that's what the slide is showing.
And then earlier you mentioned this idea of like top down versus maybe like bottom up approach. Why is it so important that it is coming from the community? Would you mind kind of going over that for students? And what's the kind of benefit of maybe having more of a bottom up approach potentially?
Yes, so often disaster management has shifted. There has been a shift in understanding of disaster management. It used to be very top down. That means people on the top, policymakers or officials would decide, okay, this should be done, and then they will, implement it in the field. However, over the years, there has been a shift in understanding, and it is recognized that people know their area, they know, they have experience. Like I was saying, they have their knowledge of, cyclone, how to deal with the cyclone, what to do in times of cyclone, use of ropes, and talking about burying their non-perishable assets and things like that. So using that knowledge and understanding their priorities is important. So they would know what should be done immediately after the cyclone, not someone who has no direct experience of that. Uh, so involving people who have direct experience of the disaster, and those who also know the theories behind it, who has the technical skills and who are being trained, it can only be most effective when both of them come together, and bringing people in the middle who can suggest that these are our priorities, and how to make those priorities into action should be the responsibility of a ministry or a department, or in this case, the management of relief. It's disaster management and relief in Bangladesh. That's what they do. So it's important to bring the people in the mix, because they know what should be the priorities, and they know the best the area and the type of issues that they have.
And just one final question for me. I know we've got lots of viewers, but we haven't had many questions. So kind of one more for me. But if you do have anything, please do write it in the chat. Is what do you think the key learning points are from, for example, this cyclone and this dual hazard that we've been talking about? What are our kind of take-home learning points?
I think the few things that we should think about is learning from the challenges we have had already. So understanding why there was this lack of coordination, why there is, what should be done to avoid similar challenges in the future. For example, that coordination issue, to avoid such challenges in the future, local authorities, other stakeholders should conduct health need or medical assessments, and they should ensure that medical provisions in advance of disaster should be made available. There should be possibility of wash facilities and systems in place, And they should be part and parcel of daily life rather than waiting for the disaster to happen. So they should be incorporated within. Um, in insufficient institutional support, there should be communication between different organizations. When there is funds, the funds should be dispersed in a manner so that all the organization know where is it going, how it will work, and how can the priorities be set together. So better communication between different institutions, better accountability. It's hard, however, it's important to avoid corruption, to avoid those things that has been seen. Unfortunately, it is a problem not only in developing nations but everywhere. And finally, I would say understanding and including people. That is, I think, is the most important among all of this, to understand what the community actually needs and wants.
Fantastic. And then the final question, just for the last couple of minutes, is we ask all of our guests kind of how they got to where they are and if you have any advice. So how did you get to where you are? And do you have any advice for students?
How did I get to where I am? Well, I always loved geography. So I actually, when I started my journey, I didn't know I will be here. So my journey, I studied geography in school. I used to love maps. I used to, I still, I'm not very good with the driving and my directions, but I still used to love my maps. So I studied geography in school. I then after college, after university, I worked a little bit. So it was a kind of a different pathway. I worked for a little bit. Then I came back and did a geospatial modeling and management degree. And that is when I got a scholarship. So I came to Europe, and then that got me into disaster management, hazards and disasters. And that's where I got more and more interested. So I decided to do my doctorate, my PhD, and worked as a researcher then. And after working as a researcher for a little bit, I got my first teaching, lectureship. And I'm learning every day. So I don't know where I will be in 5 years' time. So who knows? But geography is something I would advise. If you like geography, go for it, because this is a subject which will provide you with all the skills which you can use for so many different career choices. You don't have to be a geographer. You can do geography and do anything. So not rocket science, but apart from that, you can do anything. It brings you that understanding of the world, the place, spaces. You understand maps, you get geospatial skills with GIS and remote sensing. So it has a lot of things that you can use for any career choice that you would like to make later on. It doesn't, keep you within one thing. It gives you the world. So I think that's why I'm still learning, and that's why I said it can be any pathway you can take with geography.
Brilliant. Thank you so much. That was such a nice summary and kind of inspiration for going on to do geography. And thank you so much for being a guest on the Curious Geographer Time for Geography kind of collaboration live interview. It's been fantastic having you. So thanks so much for being a guest.
Thank you very much, Ali. It was nice talking to you, and thank you, everyone.
And just to let everybody finally know, this is the last episode in a while, actually. And so there will be some more coming up in the summer, but I'll update you kind of on a later date. But please do check out the shorter videos on Time for Geography as well. So all of our longer live interviews get created into a smaller kind of classroom clip or something, a key theme that we've picked up on. So have a wonderful Christmas and a good holiday, everybody. And again, thanks for joining live, and we'll see you shortly.